Okay, everyone, we're going to go ahead and get started. Hello and good morning. Thank you, everyone, for joining us. My name is Micah Matthews. I'm one of the marketing directors here at Messer Financial Group, and this is day 5 of our ACA week, so the last day of our ACA presentations. I hope everybody's been able to join us for the previous ones, and hopefully this one will be the best. After all, we always like to save the best for last, right? And Molina is the partner that we're going to be presenting today. So we are super excited to have them. This one's pretty much going to be an all-day event, and we are going to separate it by different markets. So we want to do state-specific for each one. So make sure that, if you're not going to stay for the whole thing, at least be sure to stay for the markets that you are primarily interested in. And just to let you know how the schedule is going to look for today, I want to post this up here. So we've got 2 sessions. We've got the morning session, which is this one. It's going to run from 10 to about noon. And then we have the afternoon session, which is going to run from about 1 to 3. And as you can see, this is market specific. So we're going to start off with South Carolina, then move into Florida, Mississippi, Michigan, Wisconsin, and Ohio. And then we've got in the afternoon, Texas, New Mexico, and Utah, Washington, and California. As you can see, huge footprint here, guys, we're going to be covering today. And I think after you see all the different opportunities for each market, you're going to see why we want to go over each one. We've been partners with Molina since the beginning. They've always been a great partner to us. We love writing with them, and we want to continue to grow our footprint with them. So, again, that's one of the reasons why we wanted Molina to be the closers for us this week. And before I do turn it over, I just want to go over a few things so everybody can see. On this page, this is our homepage, messerfinancialgroup.com. I'm sorry, messerfinancial.com. And if you notice on this page, it says calendar. All of our webinars are going to be listed on here. So if you ever want to know what upcoming trainings are available, this is where you go. And if you notice, so today is the 25th. I click on that. And there you go. And it even has the calendar. So I'm sure all of you are exactly where you're supposed to be. And it gives you a brief synopsis of what's going to be gone over. So be sure to be monitoring this calendar. Obviously, I'm sure most of you are getting our emails as well. So any future trainings that are coming up, make sure to watch your calendars. Also, want to show everyone, for those of you that may have missed the previous webinars or would like to go back and watch them again, all of our webinars that we do are posted on our website. Under this tab, Agent Resources, there's a Messer Learning Center. When I click on that, it's going to take me to all the different webinars that we've done. If you want to see the ones that are most recent, just click this top one. And as you can see, every day this week we've had a different webinar, so you're more than welcome. For those of you that are new to the ACA business, I would highly recommend joining on to the Introduction to ACA. It's basically a synopsis of how the ACA formed, where it is now, and where we feel it's going to be. And why now, if you're ever going to market ACA, now is the time. The opportunity with the new wave of people coming in that are eligible for subsidies, people coming off of group employers policies, with ICRA, it's kind of like the rebirth of the ACA is what we've been calling it. So again, I highly recommend going back and watching these. The webinar that is presented today will also be posted on our website next week. So if you guys want to go back and rewatch those again, you're more than welcome to. Also, we have an enrollment platform, MyMFG. I want to throw that out there. This is completely free. There's no fee. And anybody who partners with Messer Financial has access to it. And it does both Medicare Advantage and ACA. And it will do the entire enrollment for it. And it's super easy to use. And with the state of the country right now, with COVID and everything, we want to do everything we can to do electronic enrollments, and platforms are definitely the key to make doing business easier. So because we have such a packed day, I'm basically going to leave it there, and we're going to turn it over to our first market, which is South Carolina. We're going to run from 10 to 10:30, and Tina Martinez is going to be the one that's presenting this. So Tina, with that, I'm going to turn this over to you and let you share your screen.
Good morning, everyone. My name is Tina Mosley Martinez. I am your Marketplace Sales Manager for South Florida and South Carolina. Welcome. We appreciate you guys joining us this morning. We've got a lot of information, so let's get started. As you all know, FFM Marketplace Open Enrollment is November 1st through December 15th. This year, Molina has created a Camp Molina. So we want you guys to be ready to sell in all of your markets. You can do so by earning badges and attending training sessions. So what constitute you ready to sell? Well, great question. So we want to make sure that you guys have your FFM certification for 2020. Check that off the list. We want to make sure that your errors and admissions is up to date. Check that off the list. And that you've attended some of our trainings, just like this one. So your first badge is you've attended a state training. If you attend multiple state trainings, you can get a Trailblazer badge, which is another badge that you can earn as well. Once all of that is ready to go, you're ready to sell. So you're gonna get that ready to sell badge. Please make sure that you're ready to sell in all of your markets. We wanna make sure you guys get paid. So if you do have any questions, if you're ready to sell or not, please contact Messer and they'll be able to give you that information. This is my contact information. We're not on camera today, so I decided to put a picture of myself there. If you have any questions regarding any of the markets that we're going to go over today, each and every state sales rep is going to be on the line. We're going to be providing you their contact information. But if you do have any particular questions regarding South Carolina or South Florida, you can go ahead and give me a call, text me, or email me, and I'll be able to answer any of your questions. So the Molina story started with an emergency room physician by the name of Dr. David Molina. He saw there needed a change in the healthcare system for people on a budget. In 1980, he opened up a community clinic in California where caring for people was much more than their ability to pay. Today, his legacy lives on through the Molina healthcare system. We service more than 3.5 million members across 15 different states with all of our lines of business, which is Medicare, Medicaid, and Marketplace. His convictions remain true. We treat each and every person like a member of the family. Molina's healthcare mission is we distinguish ourselves as a low-cost, most effective and reliable health plan delivering government-sponsored care. We are a Fortune 500 company. We rank 193 on that list across 15 different markets with over $16.8 billion in revenue, serving more than 3.5 million members as of the first quarter of 2020. So we're not going anywhere. We're here to stay, and we're here to take care of your members. Currently, we're not expanding into any other states. We are expanding within a 5-state footprint. That 5-state footprint is Michigan, Mississippi, Ohio, South Carolina, and the state of Texas. We're currently in 200 counties. We're expanding into 84 more for a total of 284 counties. A lot of expansion for us this year, which means a lot of opportunities for you guys to write business with Molina. So jumping into South Carolina, very, very excited with our expansion in South Carolina, right in your backyard. We're expanding into Berkeley, Darlington, Dorchester, Florence, Greenville, Greenwood, Horry County, Lawrence, Newberry, Richland, Spartanburg, Sumter, and Union. So with this expansion, we're pretty much doubling our footprint here. And there's a lot of opportunities in the Greenville, Spartanburg, and Lawrence counties, as well as the Horry County and Florence. Very excited about our expansion. I'm going to talk about our networks on the next slide, but if there's any opportunities for Spanish-speaking agents, there is opportunities in the Greenville, Spartanburg, and Darlington areas. If you do speak Spanish, there is a need for agents there that speak Spanish. So please look into those areas if you're looking for opportunities. Very excited about our expansion, as I said earlier. Looking forward to working with you all in the entire state. So as far as our network, got a lot of questions. I'm getting a lot of inquiries as the rumors go out to see the rumors go out as far as what's happening with Molina and their network. So our network is going to be illustrated on the screen. We are going to be putting on our pod, hopefully, fingers crossed, by October 1st, all of our expansion areas with the network on there. So we get a lot of questions if we're going to have Prisma Health. Unfortunately not right now. There are negotiations, but nothing has been finalized. So Prisma is not going to be in our network as of yet. So we do have AU Medical Center and Doctors Hospital, which is in Augusta, Georgia, for those Aiken members that want to cross state lines to receive care. A little bit closer to home, it's about 30 minutes away. So good opportunities for members in the Aiken area to sign up with us because they can go into Augusta to receive care. Yes, we do continue to have MUSC and TRMC, and we just recently added on Trident Medical Center as well, and Colleton Medical Center in Colleton County. Some important groups I wanted to point out are the groups listed on the screen. We do have all of the McLeod physicians and MUSC physicians, and the United Physicians Group as well. So jumping over to Florida. Florida, no expansion in the state of Florida, but there's a lot of great opportunities. The current counties that we're in are Clay, Orange, Pasco, Seminole, Broward, Duval, Hillsborough, Miami-Dade, Osceola, Palm Beach, Pinellas, and Polk. So the illustration on the screen that is in gray, that is actually our Medicaid footprint. Hopefully, maybe in the future, we do expand into the western portion of the state, but currently we're in the counties that are listed in green. Florida's hospital network. We have the most robust hospital network out of any carrier in Florida besides a few. But I want to point out one very important hospital network in Broward County, Memorial Hospital. If you're familiar with that hospital network, there's a carrier, very large carrier in Florida that did not renew their contract with Memorial. We continue to have them in our network. We're going to have them in our network for 2021. So if you do have some members that are with that particular carrier and want to move over to us, we'll, more than happy to have that hospital network available for them. In Orange County, another large county that we went into for 2020, we do have Orlando Health, very large hospital network, very sought out by members that live in the Orange County. Very happy to have them in our network. In Hillsborough, which is in the Tampa area, we have St. Joseph's, South Bay, South Florida, Tampa General, and Brandon Regional Hospital. Clay County, we have Orange Park, and Duval, we have Asuncion, Memorial Hospital Jacksonville, and Shands, that's in the Jacksonville area. Osceola, St. Cloud, very important, part of the Orlando Health Hospital Network, Osceola, and Ponciana Medical. Miami-Dade County, very, very important. I want to point out for your agents that sell in Florida, we continue to have Baptists in our network. There was a few rumors going around that Molina had lost their contract with Baptist Hospital. That rumor is not true. I just want to make sure to point that out. We do have Baptist Hospital in our network, and that consists of any hospital that is part of the Baptist network, which would be Homestead Hospital, South Miami Hospital, Doctors Hospital. All of those hospitals remain in our network. We've never removed them from our network. So please make sure if you hear those rumors, they're not true. So jumping over to Kendall Regional, Jackson Memorial, and University of Miami Hospital Clinics, very important hospital networks. They're all there. So for Palm Beach County, we have the Bethesda Hospitals, West Boca, and Jupiter Medical Center as well, St. Mary's Medical Center as well. Pasco County, we have all the medical centers of Trinity, the Morton Plant North Bay Hospital, and Regional Medical Center. Jumping over to Pinellas County, we have all of the St. Anthony's Hospital, St. Petersburg, and Northside Hospital. Polk County, we have Bartow and Winter Haven. And Seminole, we have Central Florida Regional Hospital, Oviedo, and Seminole Hospital. A lot of great opportunities in Florida. One thing I do want to point out, I'm going to go over it in a little bit after everyone speaks about their states. We're going to take a look at the bronze plan because there's a lot of opportunities in Florida on our bronze plans. We have 2 great bronze plans, and that's going to be a very key product to be selling for Florida. So I'm going to turn it over to Dennis Pujals. He is going to speak about the great state of Mississippi. Dennis, take it away.
I appreciate it. Thank you very much, Tina. Yeah, I want to welcome everybody to the training today. We've been with Messer for a while. We're definitely one of our valued partners. So yeah, speaking about Mississippi, it's a lot of excitement going on over there. Of course, there's only two carriers. It's us and that other competitor, which we don't want to mention. But there's going to be, it's going to be very. There's a lot of opportunities for all the agents when you're coming into Mississippi. So Mississippi was one of our 2 expansion states for 2020. We came into 19 counties throughout the state, and those are the ones you can see in the aqua color, greenish color. Those are the counties we were in last year, but now we're going to be expanding 63 new counties, basically taking over the whole state. We're going into every county in the state, so no areas that you cannot that we won't be in. So we can offer services throughout to everybody. We did go into the state 2 years ago on the Medicaid side, and usually what we do with Molina when we enter a new state, we do go where we have a Medicaid footprint. So luckily with that, it does give us the ability to have our provider networks in place even prior to we go in for a marketplace side. So like I said, we're going to be going into 82 counties throughout the state. That's going to be, there's a lot of opportunities. So now looking into, Tina mentioned for Spanish speakers, through the southern half of the state, there's about 80,000 Latinos, Hispanics throughout, especially in the lower counties, which were Jackson, Harrison, Hancock, even the Pearl River, Forest, and those areas from Scott basically down, which is the center of the state down. So last year, well, we don't have pricing or anything to that nature yet, but one of the things that I can mention is our pricing in the north last year, for 2020 was a little bit higher. So and the reason for that is because we did go in with a pretty robust network, and the cost for that network was a little bit on the higher side. Now that we're going to be expanding into the whole state, we're going to be able to offset some of those prices. This I'm getting from the vice president of network providers. So don't know pricing yet, but I got a feeling it's going to be a little more enticing than it was last year. One other thing I can mention, and this actually goes for South Carolina as well, we don't upcharge for smoking, for smokers. I know many of our competitors do. That is not something we've ever done. So when you take that into consideration, our pricing is much better than the other competitors in the states. So going into when you go into the middle part of the state, center part of the state, we were much more competitive on price wise, and then we just basically owned the lower half of the state. So especially in from Jones, Forest, Lamar, and Pearl River last year, we were #1 priced throughout. We're expecting, well, I'm expecting it to be about the same. And even on the lower counties, Hancock, Harrison, Jackson, we were evenly priced. So like I said, expecting a lot of great things. There's a lot of opportunities throughout the new expansion states. Excuse me, the new expansion counties. So if you want to go into our network, which is on the next slide, I believe. Yeah. All right, so as you notice, we already have many hospitals throughout the state. Of course, we are currently adding on, every day we're adding on new providers and new hospitals to be able to maintain or to be able to facilitate all the members we have, we're anticipating to come on board. So if you notice going through the list, we already have these marketplace hospitals in place even prior to marketplace being there. So they're up on the pod right now. They are active with marketplace. So even members that are on board with us right now, they could utilize these hospitals just because they are already ready to go. That being said, there's many counties that are still missing some. Of course, there's a lot of counties, they're in the areas, and our provider network team is actively bringing on new hospitals. To give you some information, for example, down in the Gulfport region, Garden Park Hospital was on our network for Medicaid. They were just purchased by Singing River Hospital Systems out of Jackson County. So now that they're purchased and they're under the Singing River umbrella, they're going to be onboarded as well. Another one, new hospital network that we're bringing on is Ochsner's. They actually do have a partnership with Singing River. So basically, any Singing River hospitals any Ochsner members can use the Singing River Hospital Network and vice versa. So we are working with that. They're going to be adding all of their Mississippi facilities from Jackson all the way down to the southern half of the state. They're going to be adding all of their networks, their hospital and provider facility networks to our network as well. In the center of the state, we're in contract negotiations with Rush and with Anderson. Hopefully we get that finalized in the next upcoming days to have all the their hospitals in the network as well. We did just sign a new dialysis facility, which has 63 facilities throughout the state. Their name is Fresenius. So they are a very large facility throughout the state. And we are, like I mentioned, onboarding new hospital networks throughout their areas as well. So if you do have any doctors or hospital networks that you're contracting with or that you work with, please give us that information as well, so we can actually try to bring them on. So for example, Northwest Medical Center, Regional Medical Center, that's in the Helena Regional Medical Center. It's closer to the Arkansas side. One thing I do got to mention, actually, similar to what Tina mentioned with a hospital, with the members being able to cross over into other states, we do have Baptist Memorial up in the northern regions. They have about 8 facilities, 8 hospitals, even with a couple of them in Memphis, Tennessee, where if our members, if they need to go across the state line to be able to use it, as long as they're in the network, on the provider network, they're able to utilize those networks as well. So we do have it available for our members as well with many of our facilities. So we are looking, like I said, we are looking for new providers. If you have any affiliations, that could definitely assist us with that. But yeah, if you need any extra information, if you really want to get into the weeds, please feel free to reach out to me. Be more than happy to help out. And just like with Tina, she runs South Florida, we split Florida. I run the northern half, or central northern Florida. Basically, if you need anything in those areas as well, please reach out to me. I'll be happy to assist you. So if there's any questions, I'm not sure if you want to go into questions right now, Tina, or Micah, Jeff, whatever you'd like. Please.
We can do one quick one, Dennis. Good morning. Just wanted to find out from you, and I'm sure this will be nationwide. Where and how do I check my doc provider, and how often is that updated with you guys?
Tina, do you want to go to that slide?
Yeah, so I'll definitely jump over to that slide and we can go ahead and go over that information. So if you are going to be searching for a provider, you can go onto the molinahealthcare.com website and jump over to where it says find a doctor or pharmacy. Then the screen pops up that shows find a provider. Then you can either do a quick name search, or you can do a more thorough search by entering the actual location. So click on the state, whichever state that it is that you're looking for. Then you can click on the city and zip code option, enter the zip code that you're looking for. Make sure that you select the coverage, which would be marketplace, and then hit that search button. It'll give you all of the information regarding whatever doctor you're looking for. If you want to do a more advanced search, we can go ahead and go into the advanced search option and click on specialty. For example, if you're looking for a cardiologist, you can click on the specialty tab and the drop down will pop up and show cardiologist. Click on cardiologist. Same concept, you put the zip code up at the top and pick your product line that you're searching for, which would be marketplace, and hit the search button. And then the list will be promulgated and everything would be on the next screen after that. If you want to search for pharmacies, so Molina contracts our pharmacies through CVS Caremark. You can find a list of our pharmacies on our website, but you can also find it on the CVS Caremark website. Pretty much the same concept. Put in the zip code, the distance of what you want the results to come back with, and hit that search button. It'll give you all of the lists of all the pharmacies in our network. Great question, Jeff. Thank you.
Thank you.
So we're running a little ahead of schedule, and I've got KT on another call, and he should be joining us shortly. So I'm going to go ahead and go into the broker portal section. We did have a redesign on our broker portal earlier this about a month and a half ago. So if you haven't had the chance to go into your broker portal, I highly recommend you try to take a few minutes of your time to log in there. Your username to get into the broker portal is your Molina agent number. That number usually starts with an AA followed by 4 digits. So then you would put in your username is your agent number, and then your password would be whatever password you set up when you looked at the when you got your welcome letter. So once you log into your broker portal, you're going to have the option to search for your book of business, search your documents, and just to familiarize yourself with the broker portal. So what can you do there? When you click on that book of business search, you can filter the book of business by effective date, by your grace period status, or the paid through date. Once you click on that blue search button, it'll promulgate your whole book of business. And it would look something like this. It'll give you kind of like your policy number, your insurance name, effective dates, the state, the status of the member. And this year we actually had an enhancement. We entered in, you're going to be able to see the member's payment information. So whatever the amount of responsibility that they're due, which is pretty important. I know that a lot of agents were asking about that. So we went ahead and got together with IT, and they said, okay, sure, let's put it in there. So you're going to have the ability this year to see what the member's payment information is. You're also going to be able to see if they're in grace period status. So something I do want to point out about grace period status. So if you have a member that's receiving APTC and they go into grace period 1, and then they don't make that payment and go into grace period 2, don't make that payment either, and they go into grace period 3, but they decide only to make 1 payment, they're still considered to be in grace period. So we highly recommend you talk to your members to make sure that they stay up to date on their payments. If they do fall behind, in order for them to come out of grace period, they will have to make their entire payment information, their entire amount due in order for them to come out of grace period. So very important information. I want to make sure that you know how the grace period works. So I'm going to go ahead and jump over to our product information. I just want to make sure that you guys are all aware of what we're doing with our benefits this year. So we're investing in our benefits. We took feedback from all of our agents, agencies, and members of what they wanted on the plans. So we listened, and here we are delivering that message. The Core Care Bronze plans we're coming up with 2 new plans that are going to have 0 deductibles. All of our plans are going to have Teledoc for free this year for members to access. We're going to have low copays for primary and specialist services, along with free preventative care, including annual wellness exams and preventative prescriptions. On our Constant Care Silver plans, we're going to have free preventative care for adults and children. Again, free Teledoc for all of our plans. And we're going to have plans that are going to have copays for primary specialist care, mental health, lab, and radiology services. And the plans are also going to have low to no deductibles. We will have our Confident Care Gold. It's a comprehensive health coverage for individuals with higher incomes. And again, the Gold plan will have Teledoc. They're going to have a choice to purchase adult vision benefits if they wish to do so, and no cost for preventative care access with primary care without a deductible. Virtual care, again, is for free. And to avoid higher emergency room cost, we have the primary care and urgent care at the PCP copay, which is great. So for the FFM states, which is pretty much all the states that we're talking about this morning. The plan designs are going to be the same except for the state of Texas, and Gabe will go over that on his slides. But for the plans that we're talking about on the FFM side, for 2021, we're going to have 2 new bronze plans, and those bronze plans are going to be the Core Care Bronze 4 and the Core Care Bronze 5. We will continue to have the Bronze 1 and the Bronze 1 with Vision and the Bronze 2 plan. On the Silver plans, we're going to renew our Constant Care Silver 1, the Constant Care Silver 1 with Vision, and the Constant Care Silver 2. The new Silver plan will be the Constant Care Silver 4 plan. And the Gold plans will remain the same with the Confident Care Gold 1 and the Confident Care Gold 1 with Vision. So to go into a little bit more detail regarding those bronze plans, great opportunities, especially in the state of Florida on our bronze plans. So I want you to please pay great attention to our bronze plans when you're talking to your Florida members. The 4 and 5 will have a 0 deductible. Very, very important. The max out of pocket will be $85.50, and the PCP and urgent care copays will be the same. So for the Bronze 4, it's going to be $30, and for the Bronze 5, it will be $60. On the Specialist, finally, we have a copay plan for the Bronze on Specialist. The Specialist for the Bronze 4 will be a flat $90, and the Core Care Bronze 5 will be $150. As I stated earlier, Teledoc is going to be free for all of our plans, and the inpatient copays are going to be $1,500 a day with a 2 copay max. The prescription drug deductible is going to be $3,000 on both plans, and Tier 1 and Tier 2 are going to be flat dollar copays. Tier 3 and 4 are going to be 50% after deductible. Adult vision is not going to be available on the Bronze 4 and 5. As I stated earlier, it will only be available on the Bronze 1 plan. So jumping over to the Silver plans, the Constant Care Silver 1, illustrated on the screen are the FPL levels of the 100 and the 250. So we're showing you 2 different scenarios, the most highly subsidized and the 250 FPL. The deductibles will be $0, and depending on their FPL level, their max out of pocket would be, if they're highly subsidized, $1,200, and if they're in the 250 range, would be $8,500. As you can see, the PCP and urgent care, as I stated earlier, are going to be the same, and the Specialist will be a flat dollar copay depending on their FPL level. The inpatient copay is going to be $600 if they're in the FPL 100, $1,200 if they're in their FPL 250, and the prescription drug will be $0 if they're in the FPL 100. And adult vision will be available for the Constant Care Silver 1. So very important, if they do want that vision option, they will have that option available on the Constant Care Silver 1. So jumping over to the Constant Care Silver 4, this is one of our new Silver plans. It's going to be a little bit more economical on the premium side because this actually has a deductible, not like our Constant Care Silver 1 plans. So again, we're illustrating the FPL levels of the 100 and the 250. Pretty self-explanatory on the copays. As I stated earlier, PCP and urgent care will always be the same. Specialists will be $10 if they're in the FPL 100. The prescription drug deductible on the FPL 100 is included in the medical deductible, which would be the $725. And adult vision is not an option on this plan. The Confident Care Gold for the higher income individuals that want a comprehensive plan. The only difference from the 2020 Constant Care Silver Gold is our deductible and our max out of pocket is a little bit higher this year. And the member will have the option to purchase adult vision. So this is our standard metal plan design. A lot of information to digest. Just wanted to give you a quick overview of what it looks like. I know that a lot of questions come up as to what are the labs going to be, what's the outpatient services cost going to be. Not going to go into too much detail here, just going to leave it on the screen so you guys can look at it as I'm talking. If you do have any particular questions regarding any of the services, I'll be more than happy to help you answer those questions. So, you know, this is pretty much it, a high-level overview of what the services will be. And this is the silver with the cost sharing reduction included. Again, lots of detail, lots of information to go over. Don't worry, you guys are going to have this recorded on the Messer website, and you're going to have a PDF version of this presentation as well, so you guys can do your homework and look at these plans at a much slower pace. Teledoc. Teledoc, very excited to have it this year, available for all of our members for 2021 at no cost to them. So what is Teledoc? What is telehealth? This is becoming very popular, especially in this day and age with everything that's going on with the pandemic. Virtual care visits via Teledoc. So members will have access to the Teledoc feature for free. They can access it 3 different ways. They can go on to the molinahealthcare.com website and go into what's covered and click on that virtual care button. They can go on to the Teledoc website, log in with their information, and they can do it off of the Molina the My Molina Health app. So they can visit a doctor. They can visit a doctor within 24 hours a day, 7 days a week, 365 days a year, within 45 seconds. Extremely quick. In this day and age, you know, we live in a day and age that we need everything quickly. So 45 seconds is very quick. Very excited to have this option available for our members for 2021. So we've been getting a lot of questions regarding COVID-19. You know, we are going to continue to waive all of our out-of-pocket expenses related to the treatment of COVID-19 all the way through December 31st for all of our lines of business. We're waiving all of our cost shares associated with COVID-19 testing, and we will continue to provide Teledoc services for free for all of our members. Members will have the access nurse advice line in English and in Spanish. They can access that 24 hours a day, and they do have the option to have their prescriptions delivered to their home through the CVS pharmacy. Very great option as well, in case they don't want to leave their home. We got a lot of questions as to how members can make payments. We have so many options for them. There's no excuses that they can't make a payment. So they can make a payment by going onto the molinapayment.com website. It's a one-time payment option via PayNow. So if they have their subscriber ID, they can go ahead and put their subscriber ID, first name, last name, state, and zip code. Hit that submit button. It'll take them over to the page that will request their banking information, and they can make that one-time payment. We do have the option for members to register for auto pay. Highly encourage your members to sign up for auto pay. Why? Because you guys don't have to chase them for their monthly payment. Auto pay automatically takes their monthly premium out of their checking account. They can set that up by going onto their mymolina.com account and putting in their information and enabling auto pay. They can also have their payment over the phone. They can pay by phone, they can pay by mail, they can pay by bill pay, and they also have the option to pay by MoneyGram. So if you have members that don't have checking accounts and want to pay in cash, they can actually go to any MoneyGram location and do so. Premium billing member notifications. There's several different notifications that members can receive throughout the year. I just wanted to touch base on some of the notices that they'll be receiving. So if you do get phone calls from your members, you know what those notices are for. So there's 4 different auto pay notices. They can get a notice for confirmation of auto pay, meaning that they actually enabled the auto pay. They can get a cancellation letter. They can get an insufficient funds letter. So if we do try to draft that money and there's no money in the account, they will get an insufficient funds notice. And if they decide to disable their auto pay, they will get a notice as well. Grace period notices. So past due and terminations for non-payment. If they don't make their payment, they can get grace period notices. If they're due any kind of refund, full, partial, or denied refund, they will receive notices for that as well. A notice of enrollment separation, binder, which also is known as a binder cancellation notice. The cancellation notice occurs 1 month after the coverage effective date. If they don't make that binder payment, they're going to receive a binder cancellation notice. Those are just a few notices that your members can receive throughout the year. Member ID cards. So the member ID cards that we're going to be sending out are hard plastic ID cards. They will not have the PCP name on the physical card, but the electronic version will show the PCP name. So if they log into their My Molina portal and on the mobile app, it will continue to show the PCP name, but on the physical hard card, it will not show their name. The ID cards are color coded for lines of business. So if you do have a marketplace member, the marketplace ID card will be color coded in purple. So what's the timing for these ID cards? The ID cards are for new members are going to be sent out once the full binder payment is received and processed. Very important. They need to make that binder payment in order for them to get that card. For active renewals, they're going to be sent out as the member is actively renewed during open enrollment. So if you do reach out to your members for their renewals, they will receive their ID cards during open enrollment. Passive renewals. So those are the renewals that are just passively renewed. They're going to be sent out in early January. So I highly encourage you to reach out to all of your members and actively renew them so they can get their ID cards in a timely manner. All right, so I am going to jump over to some very exciting news. We have a new website. MolinaMarketplace.com is going to have a new website for brokers, members, and providers. We're rolling out the broker pages on October 1st. This is a screenshot of what it's going to look like. Just very easy to read, easy to navigate. Very excited about the new logos and the new pictures that we're going to have on there. This is already live in the state of California, so if you do sell in California, you're going to be seeing this website on the MolinaMarketplace.com site. It's completely branded just for marketplace products. So we listened, we heard your stories. There are other websites very hard to navigate. We have all of the lines of business there. It's very cumbersome to work with, so we've created this marketplace only website. So we're redesigning our health literature. Our EOCs and our SBCs are going to be much more user-friendly, easier to read. Very excited about that as well. And we will have a member handbook, our first ever member handbook. It's going to be sent out to the members with their ID cards. Very excited about this. For those of you who already sell Medicare, I'm sure you guys are used to already getting members getting those handbooks, but on the marketplace side, we are doing this brand new first time this year. Very excited about that as well. Our Molina mobile app is going to have updates. So if you do have time to download that app and play with it a little bit, I highly encourage you to do so. The mobile app is going to have the ability, already has the ability actually, for members to see their ID cards. So if they lose them, if they misplace them for whatever reason, they can pull it up on their mobile app. They can make a payment off of the application. They can change their primary care provider. So members can change their PCP once every 30 days, which is a great option. They can find doctors and find urgent cares and access the virtual care, as I said earlier. Molina has a marketing campaign that you're probably going to be seeing quite a bit across different digital marketing and streaming platforms. We're streaming these the streaming platforms that we're working with are Spotify and Pandora Radio. Very excited about that. We're continuing to use our Lean on Molina marketing campaign from 2020. We've increased our marketing budget for 2021 3 times over, which is very exciting. So you're going to be seeing a lot of Molina advertisement in the weeks to come. So I am going to see if we have Kasai on the phone. Kasai, are you there? Okay.
I don't see him yet, Tina. Not yet.
Okay, I don't see Kasai. All right. So I'm going to go ahead and talk about our broker services unit. We have our broker services team. If you've had any issues with any of your contracting or any member issues, the broker services team, not because I work for Molina, but we have the best broker services team out of any carrier. I'm just going to say it. That's true. It's all true. We love our broker services team. They're fabulous. So they're split into 4 different sections. Our broker services team helps out with general inquiries, account access issues, member EOC and SBC questions. So if you have any issues with any logging into your broker portal, the broker services unit will be more than happy to help you reset that password and get in there and get all logged in so you can see your book of business. We have our broker care team. Broker care team helps out with any member access to care issues, billing discrepancies, and termination and errors. They can actually help you out without the member on the phone. So this is strictly for brokers. So please don't give this information to your members, because this is a service that we provide to you as a broker. So if you have any members that can't get care or having issues with any pharmacy, medications, anything like that, our broker care team will be able to assist you with those issues. We have our commissions team. Fabulous commissions team. They work very, very hard to make sure that you guys get paid in a timely manner. If you do have any issues with unpaid policies, they will do a book of business reconciliation for you. You can fill out an Excel sheet and email it over to our commissions inquiry department. They'll be able to research those policies and help you out to make sure that everything is up to par on that side. Contracting issues, contracting inquiries. So if you unsure if we've got your E&O license up to date, E&O or your any licenses that you have, or maybe you've renewed your licenses and you want to update that information with us, be more than happy to deal with that on the contracting inquiries email. Send that over. We can update your information. If you have any contact information, if you move, change your cell phone numbers, please make sure you reach out to our contracting inquiries team. They'll be able to assist you. So they are in Salt Lake City, Utah, for those of you who are on the eastern states, on the Eastern time. We actually have a little bit more time on our side because we are on East Coast, so that's 2 hours time difference. We do have them available till 8 p.m. Eastern time. So if you do have any issues, they'll be more than happy to help you out there. We also, during open enrollment, they do have extended hours, so be on the lookout. We will send out e-blast with their hours of operations. So I'm gonna go ahead and hand it back to Dennis. Dennis is going to be talking a little bit more about some of the other topics that we have. Dennis, go ahead.
All right, so thanks, Tina. So yeah, just I know we're running a bit ahead of time because there's I guess these presentations were really set up to go for 45 minutes, but to get a little more in depth into certain areas, I'll go ahead. So we'll go into Florida first. overall in Florida, we don't know our price position throughout the whole state, but we do believe that with our new bronze plans, we're going to see a lot of migration over to this plan. Reason why I'm saying is, okay, for the last few years, our pricing on this, especially on the silver product, has gone up a little bit. We did it back in 2015, 16, and 17. We were #1 throughout the state. We did have that advantage across the board. But of course, we had to go through a little bit of a restructuring. The reason why was because of our risk transfer assessment and payments throughout all the to the other carriers. What ends up happening is all the carriers throughout the in the state have to share in the risk of all the other members. So the more adverse selection, or the lower the worse, I guess, the health of the members associates, they actually can receive payments from the other carriers. So because of that, we didn't do a very good job at the beginning with our assessing the risk of our members. So we did have to pay a lot of those payments over to our competition, which was not ideal. We did go through a restructuring, and it's taken us a little while back to get back into the Florida side, because Florida actually was our best state in on the ACA side. It is a monster when it comes to enrollments. For example, right now in Florida, we have in our 12 counties just under 1.4 million eligible members that you can actually offer services to. So it's taking us a little while to get back. We are anticipating a better pricing. We've actually dropped our pricing throughout the state about 4%, which should help us. But we still don't know where we're at exactly, especially with all the competition coming back. So that being said, we do have that bronze plan coming in. Now in Florida, about 42% of all enrollments last year were on the bronze plan. Okay, there was one competitive carrier that did have a zero deductible plan last year. Didn't have the co-pays like we do have this year. They had co-insurance, and they basically took a lot of the membership. They had about 70% of all enrollments last year. Now that carrier went back and told everybody not to offer that plan because they're going to be raising the prices, and they wanted to focus on silver plans. That's not a problem. We'll go ahead and take that. We'll go ahead and take those members if they don't want it. So in Florida, like I said, we're expecting a lot of migration over to that plan. Another reason why we're saying that with the bronze, and there was such a high number of enrollments on the bronze side, is on the silver side, it's basically completely based on the member's annual income. That's why there's 4 categories. You have the 100, the 150, the 200, and the 250 categories, all dependent on what your annual income levels are. So basically that 250 level are the ones that, and Tina showed it earlier on the slide, but that 250 level is basically those members that really don't receive subsidies. Those are the ones around 40,000 and above. So those are the ones that are paying full price, the higher co-pays, the higher out-of-pocket max, and those are usually the members that fall off and don't pay or fall off and their policies fall off their system. So those members are going to be able to migrate over to our new bronze plans that have co-pays. It's almost like a hybrid in between bronze and silver plans. So a lot of our members and agents were mentioning that we should look into it. But the biggest thing we notice is that if someone were to get sick, if their children were to get sick and they have to go to a doctor, they want to know what they're going to end up having to pay. That's where those co-pays come into play. Even though it's still a bronze plan, it does have that 85/50 max out of pocket, but it's going to be less. I mean, since you got the unlimited amount of co-pays of visits to doctors with the copay associated, it's going to assist us majorly in that plan. So we are anticipating a lot of migration. Like I mentioned, we're excited about our new product, and the whole, like I said, if the other carriers are not focused on the bronze plan, they're basically everybody's focused on silver. There is a lot of competition. Everybody's trying to get the best price. Well, we're going to be in the mix there as well, but the bronze plan, I believe we're going to really have it's going to have a major effect on the enrollments throughout the state of Florida. Okay, same sort of, that's basically Florida. Now in all other states, if you want to throw up Mississippi, Tina, if you don't mind. So through Mississippi, it's a complete different. Every other state, our biggest one that I'm saying that mainly about price-wise on the silver side is I'm not 100% confident that we're going to have the best pricing there on the silver side. That is mainly Florida, but in all other states, we're going to be competitive in the silver, bronze, and gold categories. So are we going to win every county? No, we're not. We're not going to be the number one in every county, but we are going to be number one in many of those counties. For example, in Mississippi, even though once again I don't have pricing yet, all the carriers have already filed for the pricing. It's there, but pricing doesn't get released to us until basically a couple of weeks before open enrollment, where you can test all the enrollment platforms. So here in Mississippi, we are actually dropping our pricing just about 4% as well. I know our competition has gone up 10% throughout the state. So, and like I said, there's only 2 carriers throughout the state in Mississippi. So as I mentioned, we are not going to be number one in all counties, but we're going to be very competitive, and we're going to be number one in many of the counties. So like I said, it's going to be a different landscape in Mississippi this year. It was almost comparing apples to oranges last year, because the competition had every county and we were only in 19 counties. Now that we're able to go everywhere, they're not going to be able to play with the pricing as much as they did before. So it's going to be competitive across the board, I believe. So,
and Dennis, if you don't mind, I'd like to just add on to that. For those of the agents that are listening, we went over yesterday the Mississippi market on our ACA landscape market, and they were all talking about your competitor, about, well, why don't you see that there's a huge opportunity with them in that market? And I said, well, the reason why is because when I'm talking about opportunity, I don't ever look for areas where there's a lock on the market with a certain carrier, and it's probably going to be that same way again. I don't go in there with that carrier's flag. I wait for the opportunities for other carriers to step up and take over that number one role into a market and have that opportunity for rollover. Because when you're talking about opportunities with us, and in North Carolina, we just had that exact experience because we only had one carrier forever. And then when somebody else finally came in and with a lower rate, that's the opportunity. That's why we made so much money by moving them over. We don't go waving the flag of the number one carrier that's in an area. We look for that carrier that's trying to earn that business and coming in with a strong product and the changes. That's how agents like us can really take advantage of it.
Now, then going off that point, 2 years ago, they were the only carrier in the state. So when we came in last year, that's when you noticed that commissions go higher. So just because of us coming in, they had to raise their commissions. And by the way, I can mention a few other things. In many of our states on the commission side, we are increasing some of them. I can't divulge what they are yet, but and the commissions will be going up in some of our states. And plus, there are opportunities for bonuses. Now, in Mississippi, for example, our competitor had 95% of the market last year when it came to enrollments. So like I said, there's going to be new bonus opportunities for the agents to earn extra bonuses or extra income for these opportunities. So large books of business throughout the state on the other side. So like I said, there's going to be, to Michael's point, a lot of opportunity for getting those enrollments over to you. And so you can have not only the increased commission side, but the increased bonus side as well. So going into, like I mentioned earlier, are we going to be number one in all of the counties? No, and there's not. But there are niche markets that you can look into. Like as I mentioned earlier, there's about 80,000 Hispanics, mainly Mexican. There are Puerto Ricans. There's Cuban communities throughout the state. Also a very large Asian community, so Vietnamese, Chinese. So there is a lot of little niche markets, or even ethnic or different communities that you can actually focus on, that you can go into. And now Mississippi is a little bit different than the other states, meaning there's billboards and paper and signs still work very well in Mississippi. I've noticed in Florida, you'll go more digital and more through email blasts and social media. But one thing that's very interesting about Mississippi is it's a very poor state. So for every dollar that they send over to the government, they receive $3 back. So that being said, they're not only used to zero bronze plans in the state, they're used to having zero silver plans in the state. So like I mentioned, there's a lot that you can go after once you're going into the enrollment side for Mississippi. Now, I believe South Carolina is similar in a lot of others, a lot of aspects when it comes to this. I know Tina's can go into that a little more, but like I said, through Florida and Mississippi, both we are. I mean, we've always been known for a robust network and provider network. As Tina went over, there's a lot going on the Florida side. Especially, I mean, South Florida has been a monster since the beginning with our network. I mean, we pretty much have everything you need in the South Florida area. In the Central Florida area, we have increased a lot. As Tina mentioned, we did add the Orlando Health networks to the network in the Orlando area. Unfortunately, we got them on a little too late to really assist us last year. We did have them contracted, but we couldn't get them onto the provider directory until the last week of open enrollment. So this year, that is going to definitely help us because especially in Central Florida, there's in the three counties, which is Osceola, or Orange, and Seminole. There are two very large networks there, which is Advent and Orlando Health. We have the Orlando Health side, which, by the way, all of the opportunities there. For example, if you look at Disney, they have an agreement with Orlando Health, not with Advent, which is the other hospital network. So with the whole COVID happening this year, a lot of those employees did lose their job, or actually the part-time employees. So many of them did have through their union, they still kept their insurance or the coverage, but a lot of them do not. And they do have affiliations with the hospitals and the doctors associated with it. So like I said, opportunities there for even special enrollments right now, or even open enrollment going forward. So like I said, in the Duval area and Clay, actually, we are increasing some of the network, the hospitals there. Ascension, St. Vincent's, Riverside, and Southside. We added Southside. We are looking for, well, there's really not much there. We are in communications with Baptist Hospital, which is a different Baptist from South Florida, but we are and trying to get in with them right now. Been going back and forth with negotiations with them. So hopefully we get them on soon. But like I said, in Hillsborough, second to none network, especially with all the St. Joseph's. Many of those members, because of our silver pricing, which was too high over the last couple of years, now that we have that bronze plan in the Tampa area, Hillsborough area, those members are going to be able to utilize that network, which, by the way, there's only one other competitor that has that network. All the others don't, and there's 7 competitors in the state of Florida. So a lot of opportunity in the Tampa area, or even in the Pinellas side, which is if you go to the next page, you can see we have the Bay Cares, St. Anthony's, very large, very sought out after hospital networks in that area as well. So a lot of exciting stuff happening in Florida and Mississippi. I know Tina, those are my 2 states, so I don't get that in depth into the Carolinas as Tina will. I know you guys, that's your backyard, but I know a lot's going on over there as well. So I guess I could throw it over to Tina so you can take back over. Thanks, guys.
Yeah, thanks, Dennis. Appreciate that. So we do have Kasai Tafese on the phone. Kasai is in charge of Michigan, Wisconsin, and, as he says, the great state of Ohio. So we're going to go ahead and take it away, KT, with Michigan.
All right, you got it. Hey, thanks a lot again. Thanks for the opportunity to talk to you guys. Looking to an exciting and probably one of the largest ACA enrollment this year. So here we go, Michigan. We're doing an expansion to 2 additional counties, Muskegon and Oceana. That's northwest of the Grand Rapids area. And our footprint is primarily on the southeastern area, which is Oakland, Macomb, Wayne County, which is Detroit. Michigan is unique. Michigan is unique in the sense that we've been very competitive in Michigan, but I think a lot of our business is actually mostly done by outside agents versus resident agents. So there's vast opportunities. A lot of it has to do with the relationship between Blue Care, Blue Cross, and Priority that are have pretty stronghold within the agent community there. So in order to meet their quota for each of these large Michigan-based agencies, carriers, they tend to overlook Molina, even though in quite a number of areas we are extremely competitive compared to ours. So the opportunity is there for for those agents, for those of you that are not Michigan based, to really grab those sales. If they don't want to sell it, definitely there is an opportunity there for you. Grand Rapids, which is Kent County, we just added a hospital called Spectrum and Spectrum Medical Group. That definitely that is a huge game changer, in which Molina has pretty much all of the major hospital systems in Grand Rapids. That actually overflows to the new counties, the expansion counties, Muskegon and Oceana, which have Mercy Health System and network specifically in their county, but Spectrum has a much larger footprint. Overall, our network is pretty decent in Michigan. We have we'll go over the network. One unique thing about Michigan also, there's a large Arabic speaking population, the Arab American population. So anyone who speaks Arabic, definitely a plus. It's definitely an advantage. When we look at the broker assisted business versus unassisted, looking at a 46%, only 46% of Molina's business is broker assisted. So there's huge opportunity to really tap into that additional 50 plus percentages of population that's coming unassisted, and we get no credit and no really don't want anybody coming unassisted. So our choice is for them to be assisted through brokers, because we know broker assisted business is better business, better retention, and better educated consumers. So anything we could do to help to that extent, I can certainly help identify some unique opportunities and partners that you can partner with in each of these markets to tap into that additional percentages. Can you move on to that slide, to the also when it comes to Latino Hispanic population in the Wayne County area and in Detroit market, there's a large Mexican population specifically. So their Spanish speaking agents are pretty much little to non-existent. So you certainly have an advantage if you speak Spanish to reach out. So there are established communities, small businesses, the Latino Commission on the Affairs on State Affairs. There are organizations that cater to the Latino community. I'll be more than happy to point out some of these Latino-based organizations and faith-based communities that you can certainly reach out to them and maybe leverage some relationship that would help you serve that community. Again, just to reiterate, huge game changer in Kent County. Spectrum is huge. Metro Health and then the Mercy Health System, that makes Molina the only competitor in that area. Really is Oscar, and Oscar only has one network system, just the Mercy Health System. So definitely #1 price position last year in Kent County, in Washington County, and Livingston County. We were fairly competitive as far as price positioning across most of our markets here. I will be, as soon as rates are out official, I will create a heat map that will give you side-by-side comparison, Molina versus our competitors, to help you guide you to where you need to focus for Molina. That's pretty much it as far as network is concerned in Michigan. Again, look forward to partnering with you. Please feel free to reach out to me. Tina will make available my contact information for you. So look forward to talking to you. Wisconsin, we did tremendous expansion last year to 22 additional counties, bringing our footprint to 29 total counties. We are not expanding into any new additional counties, but across all the way from the southeastern coast, which is Racine and Kenosha, all the way to the Brown County, which is Green Bay. There is huge opportunities, large population area, what we call in the Appleton or Brown County area, the Milwaukee area, out in this area. Our network is very, very, very good throughout the Wisconsin market. We have some of the top provider networks. Ascension, Aurora are some of the biggest that have a footprint across most of Wisconsin, especially in the areas that we're in. We are in the process on onboarding. It looks like they're going to come through Pro Health, which will be very good in helping us serve the Waukesha County area, which is west of the Milwaukee, which is close on, and also will overflow into the Milwaukee market. Now, the focus areas definitely Milwaukee, Racine, and then up in the north, what we call the Fox Valley area, which is Brown County or Green Bay, and the Appleton area, definitely huge focus. We were price competitive. In fact, we had price position #1 on the silver and bronze in that area last year. We think we'll be fairly competitive, at least similarly competitive as we were last year. There is a large in the Brown County area or Green Bay, a large Somali, I just learned, and huge Asian community, definitely an advantage in that area to focus on, and also huge Latino community as well, mainly Mexican Americans. And in the eastern part of Milwaukee, there is a large Mexican population, and they have, in fact, if it wasn't for COVID-19, there are some of the largest Latino-based events in the Midwest actually take place in Milwaukee. I participated in some of those last year. They were amazing. So again, Spanish-speaking agents will definitely have an advantage throughout, especially Racine, Kenosha, as well as Milwaukee and Brown County. Network is excellent, so look forward to your questions and assisting you with that. Ohio. We are expanding only to 1 county, bringing our footprints from 39 to 40 counties. Allen County is where we have Lima, Ohio, and it's a pretty decent population there. We do have a hospital network in that area. One unique thing about Molina across all 3 states, especially in Ohio as well, not only do our members have access to the hospital system in their county, but they have access to hospitals in the entire state. And in some cases, our members who live in the southwestern part of Ohio, in what we call Lawrence County, Scioto County, Portsmouth, they not only have access to the hospitals on the Ohio side, but we have some contracts across the Ohio River in Kentucky. And in West Virginia, our members have access to those hospital systems. And some of the rural areas, it's really important because some of these communities really one and the same. So you may have some contingent counties to Franklin County, whereas Columbus is, and where we do not have enough network availability. Our members take advantage of going into the Columbus market or Cincinnati market or the Cleveland market and in vicinity counties in order to take advantage of those networks. So the largest market area where the population center is Columbus, Central Ohio, Southwestern Ohio, the Dayton and Cincinnati area, Hamilton County, and then Northeastern Ohio, which is the Cleveland area. The Cleveland area has historically, Lorain and Cleveland, a large Puerto Rican population, so definitely Spanish is an advantage, as well as in Columbus and Cincinnati. There is a huge Latino community in both, in all 3 areas. Our network in Central Ohio is based on Ohio State University Medical Center and the James Cancer Hospital. These are very, very important hospitals, and definitely an advantage for Molina in that area. When we look at Southeastern Ohio, I was talking about here earlier, the Ross County, which is on the next page, Tina. That area has a large network. Pretty much every hospital system in that area is in network with Molina, including, as I said earlier, including the hospital systems in the Kentucky area. Cincinnati and Cleveland is Metro Health system in the Cleveland area, and then in the Cincinnati area is based on the Jewish and University of Cincinnati and the Mercy Health system. These are pretty good networks throughout the state, but the advantage is that our members actually have access to our network in the entire state. We also have been adding quite a number of urgent cares and federally qualified health centers. And that's really important. A lot of people don't realize that the federally qualified health centers, FQHCs, were where people actually went prior to ACA for to be seen based on sliding scale fees. And so even though we have ACA and they're able to go to other facilities or hospital systems, most of the low-income population, that is our population basically in Ohio, where we have Medicaid expansion, the population between 138% of the FPL through the 250, they're accustomed of going into the FQHC. So they're excellent medical home and they have large capacity to accept Molina members. Just a couple other things to mention. Grace period in Ohio for non-APTC member is only 10 days for Ohio and Wisconsin, similar as Florida, that is. So in which Michigan is 30 days, but in Ohio and Wisconsin, it's just 10 days for non-APTC members. All right, so that's what I have. I'll be more than happy to answer any questions that you may have. And Tina, am I missing anything else here?
No, perfect. I'll take it over from here. I'm going to go ahead and talk about the next slide, and then we can keep going.
Okay.
Thank you, KT. I appreciate that.
Thank you.
So we get a lot of questions as to what the pricing is going to be. Of course, in a lot of our states, it's way too early to tell. Don't know that information yet. It still hasn't been released. So this is just an illustration of what the rates, state rate changes that we've filed with in each state. Our national average was a reduction of 1.51%. In the state of South Carolina, yes, we filed a reduction of 3.64%. So very, very important for you guys to understand that we are going to be competitive. We are expecting to be competitive in a lot of our markets, our key markets. We have very aggressive goals in our expansion areas. So be on the lookout for when pricing is released. Make sure that you keep yourself up to date, and that way we can, be successful together. Another one I wanted to illustrate on here was why sell Molina. So I know that you guys have a lot of options. I know that there's a lot of companies coming in, especially in the state of Florida. As Dennis said, there's 6 carriers. So those of you who sell in Florida, you're definitely going to be needing to do your homework and do plan comparison, network comparison. But why sell Molina? So as I said earlier, Molina does have free teledoc virtual care services across all of our metal tiers. Very excited about that for 2021. We pay competitive compensations and incentives in an accurate and timely manner. As Dennis said earlier, we are going to have a bonus structure, so be on the lookout for that. Messer will be able to provide that information to you once we release that. We provide efficient and positive experience for all of our broker interactions. So we provide knowledge and self-service tools necessary to make you guys effective. So we're constantly doing trainings, we're doing portal trainings, we are doing several OEP trainings. So if you want to drop in on a particular state training, we have those going on through the whole month of October. So be on the lookout for those e-blasts that have been going out. We do have the ability to set up reoccurring payments. As I said earlier, I highly encourage you as a broker to make your members sign up for reoccurring payments with auto pay. That way you don't have to be chasing them every month, and you can be more efficient in writing more business during the OEP period. If the member pays their binder payment at the time of enrollment, they actually get to pick their PCP at the time of enrollment. So that's very, very important. If they have a doctor they've been seeing for several different years, and they want to keep that same PCP, we have that option at time of enrollment for them to pick that PCP. We are providing child vision for members under 19, so they get free annual exams, eyeglasses, and free child contact lenses instead of glasses if they don't want to use eyeglasses. We all know this day and age, glasses are not cool for kids, even though they're much easier. We also provide plans that have adult vision options. So our adult vision options are available on our one plans, so the bronze 1, the constant care silver 1, and the gold plan that is available for members if they wish to purchase adult vision. We do have mail order pharmacies. So the mail order pharmacy is available as an option for our members. One illustration that I did not enter onto this slide is we don't require referrals except in the state of Florida. All of our states are referral fee free. So except for Florida, just want to make that disclosure. Florida is the only state that we do require a referral. So I do want to let you guys know that that is the option there. I'm going to go ahead and open it up for questions. I know we're way ahead of schedule here. Micah, Jeff, do you guys have any questions for any of our marketplace sales managers that are on the call?
Yeah, we actually do have a few questions. Let's see. You guys had mentioned a kind of a common theme, having a niche, different languages, whatever the case may be. If someone did speak a different language and needed assistance within Molina, where would they go to get that? If someone, say, speaks Spanish or something, where would they be able to contact somebody within Molina, especially in somewhere like South Carolina?
Well, that's a great question, Micah. So I do speak Spanish, and we do have several members of the broker services unit that speak Spanish as well. And we do have our member services department. We have several teammates there that do speak Spanish. So it's not a particular, if any area that they need help with, everyone does have speak Spanish. Kasai does speak.
Go ahead. No. I was just gonna add. I'm sorry, Tina. I was just gonna add that our member services also have the ability with online, on the phone interpretation available for Molina members who need other language needs other than English. So there's online on the phone translation.
Correct. Yeah.
Right. Perfect. So Kasai does speak Arabic if you do have any. Sorry about that.
That's good.
Kasai does speak Arabic. So if you do have any agents that speak Arabic, he does the Arabic language as well. So we are very diverse. We help out with any kind of language requirements that you guys may have.
Do you have something where that lists all the local market managers? Is there anything that you have available where they can have
Yes,
that?
I do. So I'm going to go ahead and then share that on my screen. This is the list of all of the Molina State field reps. We're all specialists in our areas. So if you do have any particular questions regarding any state, you can reach out to them via email, phone call, or text. Everybody is a specialist, as I said, in their areas, and they'll be able to give you key points as to where to target, what type of clientele you can target. They'll be able to assist you with any of those questions.
How about if someone was looking for some brochures or just any kind of promotional ads that they could use for Molina? Where would they go and get that? Is that through the portal?
Great question. So we're going to go ahead and I'm going to send you a link where members can actually print out broker-facing, member-facing marketing materials, and they'll be able to personalize them actually and put in their contact information if they do want to print those out and hand them out at any events that they may be doing. So that is going to be available in English and in Spanish as well.
And can you just show where would somebody download your mobile app through? Is that through, I guess, the Play Store or something?
So the mobile app can be downloaded on the two different platforms. It can be downloaded on the Android system. If you go into the Google Play Store, I believe it's called, on the Android system, and on the iOS system. So if you do have any Apple phones or any Apple devices, you can go into the App Store and download it as well. It's called the Molina mobile app. So if you just type in the App Store Molina app, Molina mobile app, you'll be able to download them off of the App Store. And to log into the mobile app, you can go ahead and log in using the My Molina account. So very important to encourage your members to create that account online, and they'll be able to log in through their My Molina information.
Yeah, and every member, just you know, every member is going to have access to their own My Molina account. One request though is have them do it. I know agents love to do everything for their for their members, but it only takes one email address. So if you use your email address as an agent, you're not going to be able to use any other ones. And then not only that, the member won't have access to their My Molina account. So yeah, please go ahead. Every member is going to have access to their own their own member account through the My Molina, or in Spanish, mimolina.com. Okay, so just wanted to throw that out there as well.
Perfect. Thanks, Dennis.
And I want to make sure that everybody understands just how important having that teledoc available is. I mean, obviously, we have no idea what's going to happen this winter or anything. You know, our world was flipped upside down this year with COVID and everything. So to be able to not have to wait to set an appointment to go see somebody in person, and I'll give you an example. My daughter had pink eye actually, and I have teledoc, and you know, instead of having to go and make an appointment and wait a couple days to be able to see a doctor just to get a prescription, I was able to call the teledoc, and within 15 minutes I was speaking to a physician. He was able to look at her through the camera on our phones, and was talking to her and was able to diagnose it as pink eye, and then asked me who my preferred pharmacy was. I told him the one just right up the street, and he was able to send the prescription in, and we were able to pick it up all within, you know, an hour's time total. And I never, you know, had to get dressed up or anything. Never had to really drive anywhere, just to the pharmacy and back. So if you want to know convenience, and because of COVID, it's come so far in its development. And so, you know, that's, I guess, one good thing about what's been going on is the healthcare. But that is a huge benefit, guys, and you need to highly recommend that kind of service over to your clients, because everybody's going to want to know, how do I get the fastest answers and the fastest you know, prescriptions based off of whatever's going on with me. So obviously, if it's something serious, then you're going to want to go to the hospital or something like that. But this is definitely a time and convenience thing to have. So that's great that you do have that.
And that's a great point, Micah, because, you know, as I stated earlier on our plans, if they do want to visit the urgent care, it's going to be the same copay as their PCP. So it's not going to cost them an astronomical amount of money just to go to an urgent care if they don't want to use the teledoc feature. So we encourage our members to visit urgent cares, because it's not going to cost them a lot of money.
Hey, Micah, I just want to echo what you just said. I had the exact same experience as your daughter. I was in Wisconsin. This is last year before COVID-19. I happened to be in Wisconsin, you know, visiting my agencies. Man, I had pink eye. It was painful. I have Anthem. I've never used this telehealth stuff. First time I've ever used it, I just firsthand experience. It was so amazing. You know, same as you said. You know, I saw a physician within minutes, under 5 minutes, and prescribed a prescription, an eye drop for me right across from the hotel I was staying, and I did it right from my hotel. It is so convenient, especially when you're traveling. If you have a child under 26 that may be in college outside of the state, they have access to see a physician through teledoc, you know, away from home. So it's an amazing benefit, and the fact that it doesn't cost them anything is even better.
Yep. Yep.
Tina, as a member, what type of information is saved about me in my my account there for accessing the teledoc? Does it keep my preferred pharmacy, or is that something I would need on hand if I did call in?
So that's a great question, Jeff. As soon as you log in, it asks you, based on your address, where your closest pharmacy is, and then you provide that information as upon logging in. So the doctor, right when they see you, they already have all of that information ahead of time.
You also have to provide them a form of payment if for your prescription. Well, I guess that I take that back. That was last year when we were charging the PCP copay. It's free now. I got to remember that.
Perfect. Yeah, Casey.
I know they did ask me for that.
Yeah, free's better than a copay
Free
any
is better
day.
than the
Yeah.
copay. Exactly. The only thing you have to
Absolutely.
pay is your prescription copay.
Right, correct.
All right, Jeff,
I've
do you
got
see
another
any more?
question for you. You guys obviously have seen some of the most successful brokers all over the country. What types of grassroots marketing do you see that brokers are using, especially in rural areas, that have been most effective? Are they focusing on centers of community influence, or how maybe has that changed a little bit with the issue with COVID? How are these folks that are highly successful with you guys continuing to maintain that level of productivity? Can you speak to that a little bit for us?
Yeah, definitely. Go ahead, Dennis.
I was going to say every state's a little bit different, but they all many of the states have the same theme. So a lot of social media has been being used. I mean, you could use different links to your enrollment platforms that you could send out either through flyers or through their emails or whatever you need like that. But for example, Florida, I can say social media, more word of mouth, a lot of over the phone or telemarketing. I guess you can use that call center base if you have that, if you're making a lot of calls. So that actually works. I mean, every area is a little bit different. We definitely have, for example, in Mississippi, a lot of community events. We do events through our community engagement team where we'll go to either churches or other provider offices or just other facilities where a lot of the members engage with the community, and we have different events for that. I mean, they can get a lot of enrollments. They use different for leads. A lot of times they might have even a giveaway where our raffle where they get the members' information, and that'll allow them to give them well, you have to put a notice saying that they may receive a phone call, but basically it's one way they use a lot of they're able to get a lot of new leads for new members. Other niche markets, meaning for other also in Mississippi, billboards are working, yard signs. There are a lot of agents are going out putting yard signs. That had a lot of success last year. Even agreements with, let's say, supermarkets, that they'll go ahead and all supermarkets usually have a little sign on there. You can put the information there. Newspaper, radio, TV commercials. I mean, there's a lot of different avenues you can use to go ahead and get membership or get at least the interest to come in. So I'm guessing that might help. At least that's for Mississippi and Florida. I'm not sure if it's exactly the same for South Carolina or even Ohio, Michigan, and Wisconsin. I guess you guys could talk on that.
That's a great point, Dennis. So I've come a lot of member agents that actually set up shop in the local Walmarts. Set up a little table with marketing information, which we'll be able to provide for you guys this year. As I said earlier, have the ability to print out and personalize with your contact information. So that'll be available for them as well. I've seen a lot of yard signs as well. We can, if you guys are interested in that, please let me know. We'll have a website that you can order that from. Very different in South Carolina. I know that billboards are actually very successful over there and a bit inexpensive, not like the Florida market. Billboards are extremely expensive down here. So people really guide themselves more towards social media. Social media is the wave of the future. I know that I don't want to name any one by particular, but a lot of them that are up and coming is TikTok, believe it or not, and Reddit. So we're going to be actually advertising on Reddit. If you're not familiar with it, it's a great platform. You can put in your areas of interest, and it'll give you particular information and articles based on that area of interest. So one takeaway is please familiarize yourself with social media platforms. I know that a lot of people avoid them, but it's the wave of the future. So we have to pivot and evolve to what everyone is used to using. So, a lot of people are using, of course, local television advertisement as well, and radio advertisement. A 30-second or 15-second spiel on radio advertisement is another option as well.
And Tina, I will say one thing too. I think that's one thing we can give a lot of credit to Florida. I mean, there's a reason why there's more ACA business written in Florida than anywhere else in the country, right? It's because of the marketing. I mean, geez, you can't go down the street and not see signs or advertisements all over the place for Obamacare, or ACA, or whatever they want to call it, just all over the place. And rightfully so, because there was more options. There was more carrier options in Florida than in most states too. So they had a little more opportunity as far as making money and being able to market it like that. But now that we have the opportunity in these other states like South Carolina, Mississippi, guys, if you're not marketing it and you're not getting something out there, I mean that's a gold mine for you, especially for all the rollover opportunities. Because there's a reason why we wrote so much business last year in Charlotte, and it wasn't because we only had one carrier. It's because we had another carrier that came in last year, and we ended up taking a big portion of that market share. So again, guys, if you're looking for a way to get new business, that's definitely, I can't think of a better way than having a carrier coming into markets and being more competitive.
Excellent point, Micah. And and make sure that you look into different areas as far as community-based organizations. As Kasai was saying, a lot of churches and service communities as well, a lot of cleanup communities as well. A lot of these people, they are either self-employed or work in the restaurant and service industries, and probably don't have a plan available by their employer. So those are things that you reach out, think of things outside the box in order to get to those particular members that are prospective customers that will become your members.
And to add a couple more things, just so you guys know, there are new products out there on the market too. For example, the ICRA product, individual basically health reimbursement plan that's been available since January 1st. Now you can go to employers that have small businesses, and you can offer them they can offer their members or their employees, excuse me, not only a small group plan, but they can offer now a reimbursement plan through the individual, through the marketplace. So there's a couple different regulations to that. For example, they would, since they're getting assistance, since a member is getting assistance from the employer, subsidies will not be available to them. But the employer can actually set up a different limits of how much they want to offer their employees. You could have different categories, I guess, different levels of what they offer. You can have different different product. I guess the amounts can be different throughout the different states also. So like I said, there's other products out there which could increase your membership or increase your enrollments, and that's one that is new to the market that many members haven't even thought of. So the ICRA product is one of those products.
I just want to add a couple of things here. I know Dennis and Tina touched on a lot of the good points there. Molina is obviously increasing TV and radio ads. I'm looking at, especially in the Ohio, Wisconsin, and Michigan market, we're witnessing an increased advertisement by Molina. And then some of our carrier agencies are also, doing some TV ads, radio ads as well. And there is an event that happens in Ohio every year. It's called Obamacare Jam. So one of the things that people are doing nowadays is doing virtual events. So that is a new trend that people are actually converting some of the physical events that they used to do into virtual events by promoting them on radio, local radio, on TV. So those, we'll see how that works out, but it sounds like it should be successful. That's mainly in Columbus, in the Columbus market.
Thanks, Kasai.
And Tina, I'm sorry, we do have one more question here. Could you pull back up the South Carolina doctors? Here we go.
So, Micah, that's a great point to pull back up the hospitals in South Carolina. This is just a highlight of the actual hospital and groups. This is not the full list of our hospitals and groups. So this is just for presentation purposes, so you guys have an idea of what it's going to look like, especially in our expansion areas. Get a lot of questions regarding McLeod for the expansion areas as well. We'll have all of the McLeod hospitals throughout the expansion areas as, that we're going to be going into for 2021.
Yeah, you definitely got all the big ones for sure.
Yes, we do. Hope in the future we'll have Prisma. I know for those Greenville members, a lot of demands for the Prisma Health, but not yet. So hang tight. Hopefully we'll see for 2021 if we can get that done.
Fair enough. Jeff, did you see any other questions from the agents?
No, I think that that probably brings us to a good spot to sign off for the morning session. Just wanted to remind everyone to make sure that you join us this afternoon to review some additional states, and to keep in mind that in today's world, we're too often tied up or in our thought process about instant gratification. A lot of the things that we just talked about from a marketing standpoint, you may not see 10, 15, 20 leads come in immediately overnight. So don't be discouraged as a broker. I think in a lot of cases, it's about repetition and consistent effort to maintain those marketing ideas and those messages that you're putting out into your community. So just wanted to leave that with you guys, because I know a lot of times in the conversations that we have with agents, they get frustrated because they don't see that instant gratification. And that's something that we constantly have to remind you guys. And hopefully you take it to heart that it's almost similar to farming, if you will, that you may put in a good amount of work on the front end, but you look to reap with the crop a bumper year that may not take place immediately. So just keep that in mind, guys, as you're laying out your business plans. Some things will be immediate, other things it may take a while to come to fruition, but I can guarantee you that if you put in the consistent work, you will get results from it. And I know Dennis can speak to that from his former career as an athlete. There's just no way around getting through the hard work. You just got to put it in to be successful. So with that, I'll let Dennis and Tina close this out, and then we'll see you guys this afternoon. And thank you for joining us.
Perfect, Jeff. Thank you very much. We just want to say thank you very much for your time, for your loyalty, and for your business. We know that you guys do have several different choices on the market, especially here in Florida. So we just want to thank you, just plain old thank you. I appreciate it. Dennis, do you have anything to say?
I just want to thank everybody for joining today. Yeah, of course, either myself, Tina, and Kasai, and any of our other our counterparts on the West, if you need anything at all, please feel free to reach out to us. We can get more in depth if you'd like, get into the weeds, if you want to call it that, to see if there's any way we could help you increase your enrollments in any of our areas. I know KT is an expert in all of Michigan, Ohio, Wisconsin. As Tina showed, she knows everything, a lot about South Carolina and Florida as well. And I've been doing Florida since 2015. So it's changed. The landmark has changed immensely. And even with Mississippi, with the new expansion that's going on, there's a lot of opportunity to get in there. And if you'd like, you can reach out to us. And like I said, we'll be more than happy to help you guys to see if we can help you increase your enrollments this year. So, and then appreciate your time being here, guys.
Thank you, everyone. We look forward to working with you all. Good luck for 2021.
All right. Thanks, everybody.
All right,
Thank you.
guys, we'll see you all at 1 o'clock. Thank you, everyone.